two things inside. You have 10 milliliters of low-weight hyaluronic acid, and then separately, we have in a powder form the amino acids. When you mix the two of them, you take the liquid and put it over the powder, you have 10 milliliters to cover a big open hand. So with these two, you can cover full abdomen or knees or arms. It's enough. But if somebody has two huge inner thighs, you will need 2 vials. So one combination, 10 milliliters, one big open hand. Pretty much your hand, not my hand. So your hand should fit. Mine is too small. What we did, we already prepared them. So here we have the 10 milliliters and we put them in the syringes. So the way we mark it is exactly as the face. Tension lines on the abdomen, they're horizontal. So we're going to try to go perpendicular to them. So a point, a thumb, a point, a thumb, and so we keep on going. So with the same distance, I replicate all the points. And then I keep on going. And I keep on going. As if the belly was the sun, and I'm drawing the sun rays. Is it somehow visible? I hope so. Yeah. Good. Not the most visible marker, but we are on the right track. And then we do the same for the inferior part. We see that the tension lines, they have the same pattern. That's fine. That's perfect. Same pattern, and we'll do exactly the same. A thumb apart, and we keep on going. You see loss of elasticity? Thank you. Ah, oh my God, now this is another life. Ah.
You have very little niche.
There we go. There we go. And we're ready. Now, what we're going to do is we're going to save just a little bit of substance to trigger regeneration of the stretch marks. You see? The stretch marks, are they visible? There you go.
They are seen.
Exactly. So we're going to just use this area to show you how we inject stretch marks, but our main focus will be laxity. Stretch marks will be a little bit more just for display.
She has a cesarean?
Do you have your baby with cesarean or?
Normal.
Normal. Because I didn't see any scar, but some people heal very well. Again, same identical injection pattern. We stretch the skin, we put a full needle inside, and we inject 0.1. It's easier with 1 ml syringe, but you have to fill them more, so you need an assistant to keep filling 1 ml syringes. It's easier because you need less pressure. So especially with smaller hands, it's going to be easier. But same. But remember, the syringe has to be flat on the skin, like this. Because if you put angulation into it, it's going to be too deep. And this is it. It's pretty much a 10-minute procedure, and we just keep administrating the product. Risks, nothing, some swelling, some discomfort, and this is it. You repeat it every 2 to 3, I suggest you 3 weeks, and you do it at least 4 times. Not only I have to cover the doctors, I have to cover my own team as well. So we are. Now stretch marks. Do you want to see stretch marks as well?
Yes.
Okay, then we do stretch marks as well. I just finished the syringe and we move on to the stretch marks, and then I keep continuing with her lower part in a moment so that we see some stretch marks also. Anybody who would like to inject? Do we get any help? Anybody wanting to put on gloves to inject? Not everybody, just somebody. Thank you. Perfect. And then I will take a 1 ml syringe to show you stretch marks in the meantime. So you need to continue these ones and the lower part. Now for stretch marks. You stretch the skin as much as possible so the stretch mark becomes more visible. This is the correct depth, you see? You can see the whole needle. And you go 1, 2, 3. Then again inside. 1, 2, 3. Same, retrograde. 1, 2, 3. This is it. You want to be as superficial as you can. Now another strategy, this is the typical protocol. And this is a little bit more bearable for the patient, but if you have a ton of stretch marks, you're going to age doing it. So another thing that you can do is change the 4 millimeter needle and go for a 13 millimeter needle, the yellow one. Thank you.
Yellow one.
Mm-hmm.
0.1 you did.
Yes, for each one. But be much more superficial. You're way too deep. Way too deep. Put it flat on the skin. This is the right way to inject. Because if not, you're in the hypodermis. Now.
0.1. Aynen.
This is it. Remember, don't go deep. Stay with the syringe flat, or you can also bend the needle. I'm trying to put it in. Do you see this? This is a 30 gauge needle. Yeah. Or you bend yourself and stay flat on the skin, or you bend the needle. But you need to be extremely superficial. You see it? Now this is it. And when you retract, of course, this will feel. But the problem is that this is more painful than the first one for the patient. It's faster, it works faster, but she's an ideal candidate. She's unbelievable. Yes, but you need to be you need to stretch. Yes, body, yeah. This is, of course, faster. But these are the two strategies. So, or you take the 4 millimeter needle and you do 3 points retrograde, 1, 2, 3, the small boluses, or this option. So this is how you can approach stretch marks. You will repeat them every 2 to 3 weeks, and you will do around 4 sessions.
I guess you like the point by point one.
And
It's more comfortable for the patient. Of course, now you know at least there are 2 options, and you will pick whichever one you prefer best.
ne vereyim şeker?
And I will just go and
Okay.
load from the other side and load some more up. Trying to see here, Just focus on the stretch marks. We can keep doing.
Şimdi diz kapaklarımı yaptık, o da içer.
Öyle mi?
Ready we are. And then I will just collect all the rest of the product. To complete the abdominal injection for laxity. Can I get another green needle, the short one for Maison? The 4 millimeter, perfect. But you need to put much more, 1 ml in each, 0.1 ml in each one, a full line, go, 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 that's it. So remember, 0.1 in each point, it's much more than you expect. Normally when you push, you're used to push meso, so small quantities. The best thing is you can do it from 2 sides. Flat, full 0.1 in each one. It's perfect. We might have just very, very little left for the stretch marks if we have.
You will do this?
We'll see how much we have left.
Okay.
Because we have like 5 more points, so we'll have a little bit more for the stretch marks on that side. But I'm first finishing the abdomen for laxity, and then whatever we have left, we're gonna go for the stretch mark. I'm passing it over to you. Do you want to try for the stretch mark as well? Much more superficial. Put the syringe more. You know what's the trick to become more superficial is to put down the S of the syringe. Okay. The area is not exactly the best. Perfect. That's exactly the right depth.
Nasıl acıyor?
Hiç acımıyor. Artık yanmıyor. Ben ürün hiçbir şey hissetmiyorum ben şu an.
Yani bu kadar
Bu bu yeşil iğneleri aldığım aynı yerden almıştım. Onları hem iğnesini de beğendim. Biz onlarla bir görüşelim.
And this is how the cookie rolls in between face, body, cellulite. Literally every patient who walks in the clinic is a candidate for at least one of the approaches. So as universal as you see your toxin, suitable for all patients, regeneration is also for every single patient that we see in our everyday practice. Anybody coming with any ideas, any suggestions, any questions?
For example, the energy-based device before the procedure.
Depends which one. So if I want to do a CO2, I will do it now 10 days after this procedure, and then I will repeat Sunekos again afterwards. If it's pigmentation and I want to do thulium, I put it topically after the procedure. Yeah, yeah. If I want to do, for example, if it's cellulite and I want to do vela shape, I do vela shape and then immediately afterwards I inject Sunekos.
Başka yapmak isteyen var mı arkadaşlar? Yapıyorum ben motora bak.
Just a little bit of arnica gel and we are ready.
Sorry ma'am.
Thank you so much. You're amazing.
Dün sadece diz kapaklarımın üzerine selülit yapıldı ve anestezi ya
Kremin iyiydi.
hiç yok hayır dün krem de uygulamadık.
Ha, tamam canım. Okey. Is it effective?
You're very welcome. I'm just putting a drop of arnica more.
Thank you.
Ideal patient. Thank you.
I will bring closer.